Hello friends, today I'll be looking at anatomy of the tongue. We know what from our simple biology that tongue is a sense organ of taste. So I'll be looking at the complete anatomy of tongue today. Then look at the diagram of the tongue. At the structure of the tongue, well-labeled diagram. But before anything, I'll be looking at the definition of tongue. Tongue is actually defined as a mass of skeletal muscle covered by mucous membrane and with a midline fibrous septum separating the two muscular halves. Okay, when I say essentially mass of skeletal muscle here are either both intrinsic and extrinsic muscle. Intrinsic muscles are within the tongue, are the muscles, the bulk of muscle that make up the tongue, and they are not inserted to the surrounding structures in the mouth, but the extrinsic ones are the ones that attach the tongue to the surrounding structures. I'm going to explain that later. Okay, if you look at this structure of the tongue, you can see it has surfaces. It has the dorsum. This is the dorsum of the tongue, and this is the tip of the tongue. Inferior surface is beneath. That is the under surface of the tongue, and the root. So when you look at this, I'll be explaining the structures, all these label structures, one after the other. Okay, like I said, I've mentioned the surfaces. We have the tip, the dorsum of the tongue, the undersurface, that is the inferior surface, and the root of the tongue. So if you look at this diagram, you will see that there is I mentioned it that there is a midline fibrous septum dividing the tongue into two muscular halves. If you look at this is the midline fibrous septum. Okay, so you can see we have the two muscular half, the right and the left. Okay, if you look at here, there is a structure, an ill-defined structure called the sulcus terminalis. This sulcus terminalis actually divide the dorsum of the tongue into anterior to third. There is the oral part. This oral part faces the hard palate, and the posterior one-third. The posterior one-third. Now, I'll be explaining them one after the other. So, but before that, remember I said that the tongue is covered by a mucous membrane. Okay, I'm going to explain that later. Okay, this is introduction. I've said that tongue, and we know that tongue has functions as an organ in the mouth. There are functions of the tongue, which are tongue helps for speaking and for chewing and breathing. Okay, so there are other functions, but these are the major ones. So I'll be looking at. So remember I said that the tongue is made up of the sulcus terminalis, which is an ill-defined structure, divide the tongue into two parts. The oral part, which is the anterior to third, and the posterior part, which is the pharyngeal part. We call it the pharyngeal part, the anterior to third and the posterior one-third. So, and there's what we call the epithelium. The epithelial covering of the tongue is that of the stratified squamous, and in the oral part, it is keratinized, while on the pharyngeal part, that is the posterior one-third, it is non-keratinized. It is keratinized on the anterior part because it's the rough part compared to the posterior one-third. Posterior one-third is smooth. So the tip is the most anterior. I've shown you the tip is the most anterior and mobile part and merges into the inferior surface. The inferior surface is the undersurface. The mucus of the inferior surface is thin and smooth, similar to that of the floor of the mouth and cheek. Okay, I'm going to be looking at the anterior to third of the tongue. So remember I said that the oral part of the tongue is the anterior to third and is covered by mucous membrane. So, and this surface of the anterior to third is roughened by the presence of three papilla. This papilla is very important: the filiform papilla, the fungiform papilla, and the velar papilla. I'm going to bring out this diagram of the tongue to explain this. This papilla is rich in taste buds, okay, because you know that the surface of the tongue is well innervated, and this papilla, you can look at the diagrams, the filiform, the valate papilla, and the fungiform papilla. Okay, I'll be defining the filiform papilla. These filiform papilla are minute conical projections that give rise to velvety appearance of the tongue. This is it. These are the filiform papilla. Okay, you can see that they are conical projection, minute conical projection that give rise to velvety. If you look at this diagram, you see it's like velvety, giving it a velvety appearing look. So this very filiform papilla has no taste bud. So there is no taste bud, doesn't concern any taste bud, unlike other papilla within the anterior to third of the tongue. So I'll be looking at the fungiform. The fungiform papilla are visible as discrete pink pinhead. If you look at this diagram, you see tiny discrete pink structures, pinhead, like a pin. The heads are like pin, that of a pin. So they are actually more numerous. They are more numerous within the edges and the tip of the tongue. They have most of the taste buds within them, about 1,600 taste buds within them. So if you look at this is the velate. It is also known as circumvallate papilla. These velate papilla, they are about a dozen in number. They are not dozen in number, and they contain numerous taste bud as well. The velate papilla, and you can see they are like conical. They are V-shaped. If you look at velate, you can see it's V-shaped structure. And though individually they are about 12, there is a dozen in number. So you can see the apex is pointing backwards, and we can say that towards a shallow groove, I call it the sulcus terminalis. Okay, so this velate papilla, if you look at, I say it is conical in shape, with surrounding sulcus in each of the conical shaped velate papilla. So this depression, the sulcus, the round sulcus within it, and with accentuated wall. So the sulcus contain a lot of taste bud. Okay, I will explain more. Okay, let's look at, like I said, this is the diagram of the tongue, and this is the explanation. So about 250 taste buds are embedded within the velate papilla. So, okay, now let's look at the posterior third of the dorsum of the tongue. So the posterior third slope downward from the sulcus terminalis as the anterior wall of the oropharynx. Remember, the pharyngeal part of the tongue is the posterior third. So it slopes down from this from the sulcus terminalis, there is a depression here also called foramen caecum. That is the embryonic origin of the thyroglosal, the remnant of the thyroglosal duct, embryonic origin of the thyroid gland. From here down, that's where you get the anterior part of the oropharynx. That is the posterior to 1/3 of the tongue. Now, at the apex of the sulcus, I said it's a small depression, the foramen caecum, the remnant of the upper end of the thyroglosal duct. So there are no papilla within it. Unlike in anterior to third, where you have 3 papilla, but the lateral side of the posterior part, there's another papilla. We call it the foliar papilla. I'm going to discuss that later. So there are no papilla behind the sulcus, as I said. The smooth mucous membrane has nodular appearance from the presence of underlying masses of mucus and serous gland aggregation of lymphoid follicles. If you look at the tongue, the structure of the tongue, it appears as if the posterior 1/3 is roughened, but actually it's the smoothest part of the tongue. It is like that because of the serous gland and mucous gland and lymphoid follicles within it. That is why it appears nodular. But trust me, it's the smoothest part of the tongue. It's more smooth. It's smooth compared to the anterior to third of the tongue. So there is no papilla within the posterior 1/3 of the tongue. So between the tongue and epiglottis, there is a midline flange of mucous membrane, the median epiglottic fold. So it's bounded lateral by the lateral epiglottic fold on each side with a depression called the vallecula. If you look at this diagram, okay, this is the median epiglottic fold. Okay, so between the epiglottis and the and the tongue, that is where you get the median epiglottic fold, bounded laterally by the lateral epiglottic fold, then with depression on each side called the vallecula. So now I'm going to look at the inferior surface of the tongue. So inferior surface of the tongue is seen when you raise the tip of the tongue to the hard palate. That is when you expose the inferior surface of the tongue. When you expose it, you see a small midline septum of the mucous membrane. It is called lingual frenulum. This unites the floor of the mouth to the roof of the mouth. So lateral to this, that is where we see the deep. Lateral to this small midline septum of mucous membrane, which is called the lingual frenulum, at the anterior, at the inferior surface of the tongue. Remember, I said it unites the floor of the mouth to the tongue, to the inferior surface of the tongue. So lateral to this, you see deep lingual vein, very visible. Okay, that is where you see the deep lingual vein is very visible. Though the vein is accompanied by the lingual artery and that of the nerve, but lingual artery and nerve are not visible, but the deep vein is visible. So remember I said I'm going to talk about the foliar papilla. The foliar papilla are a series of vertical parallel folds of mucous membrane on the side of the posterior part of the tongue. They are the size of numerators board. That's where you see also numerators board, but they are not within. Let me just say they are posterior inferior. They are not within the anterior to third. That is why anterior to third. Yeah, that is why I didn't talk about it earlier much about it earlier. So I'm going to look at the palatoglossal arches. They are ridges of the mucous membrane raised up by the palatoglossal muscle. This palatoglossal muscle, I'm going to talk about the muscle because it's part of the extrinsic muscles of the tongue. They extend from the undersurface of the front of the soft palate to the side of the tongue, in line with the velar papilla. The whole constitutes the pharyngally smooth. Look at it from the diagram of the tongue. You can see the palatoglossal arch. Okay. So it's being raised up by the palatal-glossal muscle. I'm going to talk about palatal-glossal muscle later. So, okay, let's look at the test boards. Remember I said this anterior two-third of the tongue, of the dorsum of the tongue, is made of constitutes a lot of test boards. If you look at this towards the tip, that's where you have the sweet test. Okay, and because the tongue is well innervated, so the salty, this is where you see the salty test, the sour, and the bitter test. Now, let me look at the muscles of the tongue. I must say that the muscles of the tongue are divided into intrinsic and extrinsic group. Then I said that the intrinsic muscles, they are within the tongue, wholly within the tongue. They constitute the bulk of the tongue, not attached to the exterior, to the surrounding structures in the mouth. They are within the tongue. They are responsible for the shape of the tongue. Then extrinsic muscles have a bony attachment. These muscles are attached to the hyoid bone. They attach to other surrounding structures, styloid processes, genital tubercles, and co. So they are attached to the surrounding exterior structures other than the tongue. So, and they are responsible for movement of the tongue in the mouth. So there are 4 muscles in each half of the tongue, with midline septum dividing the organ into 2 symmetrical halves. For the extrinsic, so the extrinsic muscles are 4 in number. So likewise, the intrinsic muscles, likewise the extrinsic muscles. Okay, so intrinsic muscle, we have the superior and inferior longitudinal, the transverse muscle, and the vertical muscle. Okay, I'm going to talk about the longitudinal muscle. Longitudinal muscle are within the immediately below the mucous membrane of the tongue. That is for the longitudinal muscle. Let's look at the diagram. Okay, this is longitudinal muscle. You can see the mucous membrane immediately below the mucous membrane. That's where you see the longitudinal muscle of the tongue. The transverse muscle actually radiates laterally from the midline as the transverse muscle, from the midline of the tongue, the median septum, laterally, while the vertical muscle arises from the median and paramedian septum and radiates vertically. So these are the intrinsic muscles. They are within the tongue, no attachment to the exterior surrounding structures. So the extrinsic muscles, remember I said the intrinsic muscles are responsible for the shape of the tongue because they constitute bulk of the tongue. Then I'm going to talk about the extrinsic muscles. The extrinsic muscles, we have the genoglossus, the hyoglossus, the styloglossus, and the palatal-glossus. I'm going to be talking about each of the muscles one after the other, their origin and their insertion. Okay, with this structure, if you look at this structure, let's talk about the genoglossus muscle. Genoglossus muscle arises from the mental spine. That is the genital tubercle, and superior genital tubercle of the mandible, and the fiber radiates backward in a fan-shaped manner to be inserted into the mucous membrane of the tongue, with the lowest fibers passing down to the hyoid body. Look at it, fan-shaped, okay? With the lowest parts, this is inserting to the lower part of the hyoid body, the lower part of the genoglossus muscle. So this is the genital tubercle of the mandible. You can see it's a fan-shaped, in a fan-shaped manner, inserted into the mucous membrane of the tongue. That is the largest part of the extrinsic muscle of the tongue. So I'm going to talk about the hyoglossus muscle. The hyoglossus muscles are like quadrilateral. You can see it, the hyoglossus, like quadrilateral. Look at where it interdigitates with the styloglossus muscle at the upper part before inserting to the side of the tongue. It's like a quadrilateral originating from the body, the length of the greater horn of the hyoid bone. So you can see like a quadrilateral, like something quadrilateral, something that has a quadrilateral is something that has 4 sides, and interdigitates here before inserting to the side of the tongue. So the other muscle is the styloglossus muscle. This styloglossus muscle arises from the front of the lower part of the styloid process. Okay, look at it, the styloid process. Okay, and upper part of the stylohyoid ligament. It passes forward below the superior constrictor to be inserted into the side of the tongue, interdigitating with the upper fibers of the hyoglossus muscle. So I'm going to look at the palatoglossus muscle. That is this muscle. You can see it on the surface of the tongue. So this descends from the undersurface of the palatine aponeurosis to the side of the tongue, forming with its fellow of the opposite side, the palatoglossal arch. Remember I said the palatoglossal arch is the fold of the mucous membrane, which is being lifted by this palatoglossus muscle. So this is about the intrinsic, extrinsic muscles of the tongue. You can see these four muscles are actually attaching the tongue to the surrounding structures. Okay, they are responsible for the movement. You can maneuver the tongue in different directions. It's the responsibility of these extrinsic muscles. The genoglossus muscle, okay, clinically, if genoglossus muscle is paralyzed, the tongue slumps back to cover the airway. I'm going to talk about that later. Okay, now let me look at the blood supply, okay, of the tongue. So the tongue receives its blood supply primarily from the lingual artery. We know that the lingual artery is a branch of the external carotid artery. Then the lingual vein as well drains the tongue into the internal jugular vein. The floor of the mouth also receives blood supply from the lingual artery. So there's also a secondary blood supply to the roots of the tongue from the tonsillar branch of the facial artery and ascending pharyngeal artery. The area in the neck, sometimes called the pyrogough triangle, is formed by the intermediate tendon of the digastric muscle, the posterior border of the mylohyoid muscle, and the hypoglossal nerve. The lingual artery is a good place to stop severe hemorrhage from the tongue. So it's very, very important. So this lingual artery gives several branches. You can see it passes deep to the hyoglossus muscle, and deep branch, dorsal lingual branch. Then before it passes deep, so it passes deep underneath it gives out dorsal branch. Immediately it's passing through it gives out a dorsal branch, dorsal lingual branch into the posterior part before it gives other branches. Well, I don't want to go deep into it. Okay, this is actually the venous supply, the venous drainage. Sorry, let's talk about the lymphatic drainage. Okay, the lymphatic drainage. We have about 3 nodes into which the tongues is being the lymphatic of the tongue is being drained into. The tip of the tongue drains to the submental node. Then there is the submental. We have the submental node, the submandibular lymph node, and the jugular omohyoid. So the tip of the tongue drains to the submental nodes, while the left and the right half of the anterior two-thirds of the tongue drains to the submandibular lymph nodes, while the posterior one-third of the tongue drains to the jugular omohyoid node. So I'm going to talk about the nerve innervation of the tongue. So innervation of the tongue consists of motor fibers. We have motor innervation, we have taste innervation, and we have the sensory innervations. These are very important. So the motor innervation of all the intrinsic and extrinsic muscles of the tongue is supplied by the hypoglossal nerve, the cranial nerve 12, except that of the palatoglossus muscle, which is innervated by the vagus nerve, the cranial nerve 10. This is very important. So all the intrinsic muscles and extrinsic muscles are innervated. The motor innervation, that is the motor innervation, is by the hypoglossal nerve, the cranial nerve 12, and that except that of the palatoglossal muscle, which is innervated by the vagus nerve. So innervation of taste and sensation, we know, is different from the anterior and the posterior part of the tongue because they are derived from different embryologic structures. I'm going to talk about the embryology of the tongue later. So pharyngeal arch 1 and pharyngeal arch 3, 4 respectively. So anterior to third of tongue, anterior to the valid papilla. Okay. So for the test, let's talk about the anterior to third of the tongue. Okay, that's before the valid papilla. Remember I said this sulcus terminalis divide the dorsum of the tongue into anterior to third and posterior one. So that is the oral part and the pharyngeal part. So at the oral part now, for the test, you know, the oral part is made of several test boards. So for the test, what we call coda tympani branch of the facial nerve. This is what is responsible for the anterior to third. This is what is responsible. That is cranial nerve 7. Via special visceral afferent fiber. So this is what this coda tympani branch of the facial nerve is responsible for the test in the anterior to third of the tongue. So for the sensation, so the lingual branch of the mandibular division of the trigeminal nerve, the cranial nerve 5, via general visceral afferent fibers. So for the sensation is the mandibular branch of the trigeminal nerve that is responsible for sensation at the anterior to third of the tongue. So I'm going to talk about the posterior 1/3 of the tongue. The test and the sensation, that one is for glossopharyngeal nerve. You can see the difference. For test and sensation, it's just glossopharyngeal nerve. That's cranial nerve 9. Via emission special and general afferent fibers. So base of tongue, that is the base of the root. You call it the base or the root of the tongue. The test and sensation, there is internal branch of the superior laryngeal nerve is what innervates the base. Okay, it's a branch of the vagus nerve, cranial nerve 10. It's also a branch of the cranial nerve 10. So I'm going to talk about the embryology of the tongue. So the embryology of the tongue, how the tongue is being formed. The tongue begins to develop around the 4th week of intrauterine life. Around the 4th week. That's what we call the median swelling. It starts to grow. That median swelling is called the tuberculum impar. It starts to grow. And we have from the first pharyngeal arch. Okay? From the first pharyngeal arch. So the median swelling, which is called the tuberculum impar, start to grow. Then, but other two swellings, the lateral, we call them lateral swellings. They start to grow around the 5th week, but they overtake the growth of the tuberculum impar and overlap it. Okay, that is how the anterior to third of the tongue is being formed. So you can look at it. The margin leads to the formation of the anterior to third of the tongue. Since the mucosa overlying this area of the tongue has its origin from the first pharyngeal arch, it receives its sensory innervation from the mandibular branch of the cranial nerve, that is trigeminal nerve. So, meanwhile, from the mesoderm, for the posterior 1/3, from the mesoderm of the 2nd, 3rd, and the 4th pharyngeal arches, another medial swelling known as the hypobronchial eminence, begins to develop and form the posterior 1/3 of the tongue. The mucosa overlying this area of the tongue receives its sensory innervation from the 9th cranial nerve, that is the glossopharyngeal nerve. I talked about it earlier. The posterior most part of the tongue develops from the 3rd median swelling arising from the 4th pharyngeal edge. This area of the tongue receives innervation from the superior laryngeal nerve. I said it earlier. So this is about the embryology. So now let's talk about the surgical consideration. Remember I mentioned about the foramen cecum. That foramen cecum is the remnant of the embryonic region of the thyroid gland, thyroglossus duct. So there, thyroglossus duct is formed. So the thyroid gland begins to develop on the floor of the embryonic pharynx at the point called the foramen cecum, which is located at the dorsum of the posterior tongue. So immediately after the sulcus terminalis, that depression is called the foramen cecum. The developing gland then relocates to its ultimate destination in the anterior neck by migrating down the thyroglossus duct anterior to the hyoid and the thyroid cartilage before stopping anterolateral to the superior aspect of the trachea. The thyroglossus ducts ordinarily disappears, but remnants of its epithelium may remain, allowing for the partial development of the thyroglossus duct cyst in this area. So, this cysts generally occur in the neck, close to or inferior to the body of the hyoid bone. They form a swelling at the anterior midline of the neck that is painless, fluctuates, and moves up upon swallowing. So these thyroglossus duct cysts are typically removed surgically. So that's about the surgical consideration about the thyroglossus duct cyst and originating from the foramen cecum. Okay, now the clinical significance. I'm going to mention a few clinical significance. The first one is ankylosing. This ankylosing, when I talk about the lingual frenulum, which is a small midline septum that connects the floor of the mouth to the roof of the tongue. So now, sometimes this lingual frenulum may appear short. We call it may appear short, or it may extend to the tip of the tongue. So this may actually affect speaking, eating, swallowing, and some other issues. So we call it ankylosing. So surgically it can be corrected anyway. So then we talk about the fissure tongue. This fissure tongue is known as the scrotal tongue. It occurs when you have several small furrows on the dorsal surface of the tongue. So it usually it's benign and usually seen in patients with Down syndrome. So then geographic tongue, also known as benign migratory glossaritis, is a benign asymptomatic condition characterized by large red patches with grayish-white border covering the dorsum of an otherwise normal tongue. Because that is when there is inflammation of the mucous membrane, that's when you see geographical tongue. So, which results in loss of lingual papilla. The lesions are known to migrate over time. The name arises from the map-like appearance of the tongue in this condition. So, then another important one is obstruction of the airway. Remember I said that this muscle, the largest extrinsic muscle, known as the genioglossus, sometimes it can be paralyzed, maybe during anesthesia or total relaxation. This has tendency of blocking the airways because it tends to retract the tongue to cover the airway. Okay, so when this thing happens, an artificial airway is made, okay, using intubation, which prevents the tongue from falling backwards and blocking the airway. So there are some other ones, which is the Ludwig angina infection originating from the heart. When the tongue enlarges 2 to 3 times its size, it can cause obstruction. So the tongue plays a major role in breathing. As such, is involved in the collapse of the upper airways in obstructive sleep apnea syndrome patients. So this is about this. There are some other ones, but these few are the one I could present because of time. So this is about the anatomy of the tongue, well simplified. So if you like what you watch, just give me a thought, just subscribe to my channel, and I'll bring you more. Don't forget to like as well. Thank you so much. I appreciate you. You can leave your comments, your suggestion will be very important to me.